ladies and gentlemen, the woman of the hour, Dr. Ayla Stanford.
Wow, okay, I forgot that story. Where is she? We certainly were on the flat. That was interesting. Well, good afternoon, everyone. Good afternoon. There are too many people to thank. I see so many of you out here, but if you guys will bear with, what's my time?
As much as you
No, but what time is it? So I can stay on time.
1:40.
Okay. If you will allow me, I really have to thank some folks, okay? Well, I'm gonna start first with God, who continues to guide our steps, making a way when there was no way at all, finding money for us, finding PPE for us, finding qualified, licensed staff to take care of people. To my parents who met and created me in North Philadelphia. Where's my mom and dad? Right there. Yes, right over on 21st and Diamond. I'm just saying. To my brother, who is my ride or die, right here. To my children who constantly inspire me and push me to do the most. Raise your hand. You can tell the one that's a teenager. And to my husband for his continual presence and strength by my side. Here, here. I just got to get all these out of the way. So my grandmother, Dr. ASHE Stanford, for some of you who may know, she was the first Dr. Stanford. Then there was me, Dr. Stanford, and then there was my sister-in-law, Dr. Stanford, who is actually leading our behavioral and mental and emotional health here at the center. But my grandmother, who is PhD, MBA, Wharton, and all that stuff, who did all the city and regional planning, got a group of people together to make this happen. She did that. Where are you? Can you please look way in the back as usual, in the back. But she did that. Even though retired, she got architects, she got construction people. We went to visit sites. She taught me what L&I was. She taught me about what these permit BERT numbers were. She taught me all of that. And so if I haven't thanked you enough, I am thanking you here. We would not be able to have done this without you. Here, here. ASHE. And then there are those people that I called the day of and said, we gotta do something, what we gonna do? And that was my pastor, who was up here quick and then went back. But I said, what are we gonna do? And we met at the church. We drove around Philadelphia and we tested everyone that needed a test. And because of his relationships with pastors of this city, every church opened their door to us. Every church opened their door. Some more than others, but they still opened their doors to us. And so I will always be grateful to you for that. Thank you, Marshall. Lorena said it quick, but she was the first one that gave us some money. I'm just gonna be honest. She was like, Doc, these folks don't know who you are. They don't know who this black woman is. She said, but this I can write you a check for to get you started. Here's a little something, baby. Go see what you can do with that. Thank you, Lorena. Yes. And Congressman Evans, in the beginning, I know you knew my grandmother. I know you didn't know what to make of me, but the connections you helped us make with SEPTA, with City Council, with the mayor's office were very helpful. Yes, I appreciate that. The phone call absolutely matters. And then there's this young woman who is an attorney turned art curator turned artistic person, which you're going to be able to see her work, and her name is Dory Brody. Where is she? All the way in the back. Come up here. And she purposefully wears the dress with hands because she can't hug you right now. But she is someone I met through social media who is brilliantly talented, and when you see the artwork that is welcoming inside of this, you will see what a true gem she is. So thank you so much. And then there's all these folks that I'm just going to group and say all these folks that at 1 o'clock this morning, sorry, Pastor Spalding, 11 o'clock last night, they were still here, mopping the floors, sweeping the floors, vacuuming, getting furniture because all the stuff we ordered weren't in, and then I came in and it was all here. And they have been that loyal from the very beginning. They have been that loyal. Gabron, there are no words.
There's one word.
ASHE. There you go. And everybody, you just know I love you. I was giving a grand rounds at the University of Pennsylvania, and someone said to me, you know, Dr. Stanford, I admire your work, but what about the safety, the quality, and how have you managed to uphold these high standards? And I said, well, one of it's continuity of our staff. The same folks who are here standing with me, many of them were with me in April of 2020. So while lots of other people were leaving jobs and quitting and going to other places, these folks, they've been right here since the beginning. And so we literally went from testing on Wednesday to vaccinating on Saturday. It was because it was the same group that I trusted from the beginning, that I had my back, they had, you know what I'm trying to say, we had each other. And I said, y'all, we're gonna vaccinate tomorrow. They were like, okay. We're gonna vaccinate for 24 hours. All right, we got it, we got it. And we're going to K&A to vaccinate. All right, we going to the homeless shelter. Okay, we going to the project homes where there was a shooting last night. What time? That's my crew right here. Okay. And, you know, there's a captain from the fire department back there, Derek Bowman, there's Alan Dom, there's Derek Green, there's Larry Krasner, all folks that we have had conversations, and I appreciate you and your support, and I can't wait to see what we're going to do next, okay? All right, now, that I had to get it out the way. Believe it or not, the list was longer than that, because I see godparents, I see my college roommate out here, I see all sorts of folks, and everybody from Deliverance. Okay, now, in this community, in all of Philadelphia and the region, people let us know that they needed more of their healthcare delivery. And yes, we tested over 25,000 and we administered over 50,000 vaccines and counting. But God willing, this pandemic will end and it won't be here forever. But then what happens? What happens to the people that have come to rely on us and our permanency here? For folks who are not familiar with us, the Black Doctors Consortium, and even when I was thinking of the name 17 months ago, purposefully created it so the COVID-19 could come out of it, and it would be the Black Doctors Consortium. But we take care of everybody. Even yesterday, we vaccinated 233 people in like 4 hours. I was like, where did they all come from? And they were Black, they were white, all different socioeconomic status. I saw PHA, I saw fire department, I saw school district. They were all here, seniors, young and old. And that's what makes us unique. First, we have come to the people, educating, promoting health, preventing disease, and providing a safety net for those most vulnerable. But that has to be the mantra of every healthcare system, that people deserve the right for equitable care, and that it's a privilege for us to take care of you. And that's how we treated every person we encountered, that it was a privilege that you allowed us to touch you, to test you, to be a part of your world. that we could listen to you and you to us. So as much as we've been there for you, you have also been there for us. So thank you. Second is the trust. No one had to trust us because I was Black and because the name was Black Doctors. We had to earn that trust. And you earn that by being proximal, by being close to the people, by being present every single day. When there was a snowstorm and everyone shut down, we were open. When there was even a hurricane, Isaiah, we were open. We worked at night. We worked early morning. If people could be here at 6 in the morning lined up, then we could be here as long as you needed us. Third, the environment should be inviting. Look at where you're standing, right? We dug up this whole walkway so we wouldn't have one senior fall because of the cracks. Tommy, where's my landscaper? Tommy, wave your hand, Tommy. And you all wouldn't know it, but he does all the displays at the flower show for years. He's not somebody you see, but he made this look nice for this community. The environment, it should be inviting. Just because we're in North Philly doesn't mean it can't be green. It doesn't mean we can't have mulch. Amen. Right? And I want people to know that this should be the norm. This should be what you come to expect. This is what we are building, and we are just getting started. And fourth, and finally, the preventive disease, the health, and the mental wellness. The leading causes of death, not here just in Philadelphia, but across the world, are number one is cardiac disease, is cancer. Right now, it's COVID, and it's casualties. Those are all preventable. Cardiac disease, we want to be able to take care of folks' hypertension before they have a stroke. The cancer, the prostate cancer, the breast cancer, the colon cancer that's so pervasive in our community, we want to get folks with early detection. So when you find out you have it, it hasn't riddled and spread through your body. But in the community, because this community kept the city of Philadelphia going while all the rest of us were sheltered in place. They went to work. They were on the buses. They were contracting COVID at higher rates. But when they got off work and they needed to go to a doctor, everything was closed. So now, when folks come out of church and they go to Bible study and they come here, they're going to have a place to go. When the people from the project homes across the street need somewhere to go, they're going to be able to walk here and get expert care, the same as if they had to travel several buses to go somewhere else. When those high school kids come out of Dobbins and they want to see what it takes to become a doctor, to become a nurse, to become a lawyer, to become an artist, because that's all these people back here. They're going to be able to come not far to go somewhere. They're going to be able to do that right in their neighborhood. That's who and what we represent. The mental and emotional wellness is so critical. And receiving that from someone who has a lived experience that looks like you. If you ask how many of us know someone who has been impacted from gun violence, raise your hand. So many of us. These are the folks that will be taking care of them. So when you're impacted, you're that person who was shot but you didn't die. We're going to be here. You're the person who lost someone, and because you had so much rage, you then became a perpetrator. Maybe we can be part of changing that cycle of violence with our presence here. There's so much work to do, but I can't wait as we are changing this narrative every single day. No longer will it be like it was 24 years ago when I graduated from medical school, that African Americans and Latinx have a shorter life expectancy, that they have more invasive types of breast cancer, because actually Black women do not. It's just diagnosed so late that their life expectancy is less. We are going to change that. Everything you see here is from sacrifice, it's from personal donations, it's from y'all $5, $10, it's from corporations, and I am excited for when we do get some federal dollars, state dollars, city dollars, any dollar. I am excited for it. But what I want, and I believe it's coming, that is not any shade, I believe it's coming. But I say that to say that we did this without $1 million, $2 million, $5 million, $20 million, we did this. And so, everything else will help, because the sustainability of what we're doing here has got to last. It must outlive me. It has to outlive me. And so for all the students and young doctors, where's Dr. Sturgis?
She's behind you.
She was, yes.
And Dr. Gonzalez.
And all these folks now, she's in the ER at Einstein, but she was with us as a medical student. And now she's a doctor. We are building this so that that next generation doesn't have to write a grant every 6 months. They don't have to knock on doors and pass the plate. That this is sustainable because we are vital for this community. We must not leave. We cannot go back to what it was before COVID. Because quite honestly, healthier people are happier people. They're more productive. They got something to live for. When you don't have something to live for, that's when you take a life. Give somebody something to live for. When you feel good, you want to pursue excellence. We will be committed to that, patient-focused, patient-centered, with the vision of knowing that everyone deserves equitable care, and we are here to provide it. Thank you. Thank you very much.